Social Security. Most of us will interact with it at some point in our lives, but many of us don't know how it works or how it will apply to us. So that's what we're going to talk about today. And if you think that this is just for those that are close to retirement age, well, think again. You need to be thinking about this at any age, at any point in your career, whether you are a few years in or you're a few years out from retirement. So stay tuned because we have a guest who is going to tell you everything. Well, maybe not everything, but a lot of things that you need to know about Social Security. So welcome back to TRS Talks, our live stream series that's designed to help you during this open enrollment period and beyond. Because again, your retirement planning is not just based on your pension, but other aspects as well. Now, this is going to be recorded, or it is being recorded, so make sure that you like and subscribe so that you can watch the replay on YouTube or the social media channel that you are tuning into today. So with us today, we have Cindy Lundquist, who brings more than 5 decades of knowledge and expertise on Social Security. She began her career with Social Security in 1972, the Social Security Administration, working her way up to a high-profile position as an executive assistant to the regional commissioner of the Social Security Administration in Atlanta, Georgia in 1987, where she remained an integral part of the organization until she retired in 1999. Since retirement from the federal workforce, Cindy is a professional retirement consultant, advising clients and teaching employees in the public and private sector about retirement plans, 401ks, Social Security, and Medicare. Cindy is a frequent speaker for public and private audiences, including financial and law firms, insurance companies, Fortune 500 corporations, and government agencies like ours. Cindy graduated with honors from Georgia State University, my alma mater as well, with a degree in finance. So welcome to our podcast, and thank you so much for joining us.
Thank you, Winston. Thanks for allowing me to be here with all of you.
Oh yeah, it's always a pleasure. And if you've attended one of our half-day seminars, then I know you've seen this face before. So yeah, you are in for a treat. And if you haven't, another reason to stick around. So let's go ahead and get into questions. How about we? All right.
Great.
So some people have no idea. What is Social Security?
Well, Social Security, the whole intention of Social Security is a source of income or a portion of income that you lose due to retirement, death, or disability. So in 1935, legislation was passed during the Great Depression because people were retiring and didn't have any income. So Social Security is a program not only for retirement, but for survivor and disability benefits when you lose a source of your wages due to any of those 3 actions.
Gotcha. Okay. So for somebody that may be expecting Social Security, some type of Social Security benefit, what are the eligibility requirements?
For retirement benefits, you have to be at least 62 years old. You have to work and pay into Social Security in order to receive a check. So to meet the criteria to work and pay into Social Security, you have to have what is called 40 quarters or 40 credits, which means that you are contributing to the Social Security program for about 10 years. So it's a compulsory tax for private sector employees. And the government, the employee pays into Social Security, the employer matches it, and if you're self-employed, you do it as well. It's a compulsory tax for private sector, but there are some state and local entities, like some counties with Georgia Teachers Retirement System. The firemen in Atlanta don't pay into Social Security. So government entities can opt out, but private sector employees cannot opt out of the system. It's a compulsory tax. So you have to pay the taxes and have taxes on your earnings for about 10 years of work, in addition to being at least 62. And that's for retirement benefits. Do you want me to explain the other benefits as well?
Yeah, absolutely. That leads right into my next question.
Well,
what are the different types of Social Security?
So Social Security retirement is at 62 or older, and you've paid in at least 10 years. The disability, well, let's go to survivor benefits first. For survivor benefits, the worker must have paid into Social Security and have the 40 credits, or if they were very young, they don't have to have as many. If they weren't old enough to have 10 years of work, it could be less. And as a surviving widow or widower, you have to be at least 60 years old in order to draw a check. And minor-age children under the age of 18 or disabled children that became disabled prior to 22 can receive on a survivor record. And then for disability, you have to be so disabled that you're unable to do your current job, and there's no other job that you can do based on your age, education, and prior work history. So you have to be basically totally disabled, and in addition to that, you have to, again, work and pay into Social Security. Social Security is like an insurance program. This is my insurance for retirement. It's not welfare. I worked, I paid into Social Security, I'm going to get a retirement check. For disability, you have to work and pay into it as well. But in addition to having your 40 credits, you have to have recent credits. So I may have worked for 10 years and then stayed home with my son. I didn't work. And then when my son was in middle school, I decided to get a job. And 2 years after I was on that job, I became disabled. I have to have at least 5 out of the last 10 years of work paying into Social Security in order to draw disability. So there has to be recent. It's almost like I have to have my disability insurance plan recent. Up to date, I had to pay my premiums. Gotcha. So those are how you become eligible for the various parts. And that's just a very brief overview, very brief.
Gotcha. Okay. So that's good. So to recap, and please correct me if I'm wrong, you have to pay into Social Security and to receive a benefit, and there has to be some recency around the time that you've paid into Social Security to collect for some of those benefits. I got you.
For disability. For retirement, I could have worked 10 years ago. Worked for 10 years, and then for 20 years didn't work and pay into Social Security. But I would still get that retirement check because I had my 40 credits.
Okay. So that's good to know.
Yeah.
All right, so for the people that are paying into Social Security and can expect a benefit, how would one go about maximizing that benefit?
Well, Social Security's calculation is very complex, and I'm not going to go into all the ins and outs of it, but basically Social Security bases your check on your highest 35 years of earnings. Not your last 5, not your last 10, but your highest 35 years of earnings. So the more you pay in, basically, your wages, the higher they are, the more Social Security taxes you're paying on them, so your check is bigger. So the more I'm paying in, the more years I pay in, and the higher my wages are, would be a bigger check.
Gotcha.
And that's just a good way to look at it. 35 years.
Gotcha.
35 years.
And that's in a sense similar to how the pension works.
Sure.
The higher your salary is, the longer you work, the greater that benefit is. So that makes sense.
Yeah.
Now, most of our audience here are going to be educators or in the education system. So is there a best time? This is a question that we get in the pension system. Winston, what is the best time to retire? When should I pull the trigger? Is there a best time for Social Security?
Well, for Social Security, especially, and I'm going to strictly speak on retirement benefits. If you're eligible for a Social Security retirement check at 62, but if you start your checks at 62, they're reduced for taking them early. You have a full retirement age, and I believe with our audience, it's probably 67 for most everybody that's listening to us. If you're born in 1960 or later, it's 67. I'm much older than probably everybody. Mine was 66, but it is 67 now. So if you take your checks at 62, you're 5 years ahead of your full retirement age of 67. Your check is reduced 30%. If I wait till 67, then I have an unreduced check, so it's a bigger check for the rest of my life. If you take it reduced, it stays reduced forever. So that's a penalty that you have to understand. Now, you will have cost of living increases, but the 30% reduction stays with you. If you don't start your checks at 62 and you don't start them at 67, every year you wait beyond 67, it's increased 8%. So when somebody asks me when is the best time to take it, it's really a hard answer because, excuse me, everybody's needs are different. And also I need to say that if you are 62 and you want to start your checks, there's an earnings limit that you can earn so much money and draw a check. And that earnings limit this year is $22,320, and next year it's going to be $23,400. So if I'm working, making $60,000, $70,000, $80,000 a year, it doesn't make sense to file for Social Security because they're not going to pay me. So definitely, if somebody says, well, should I start mine at 62, I would ask, are you working? If you say, yes, I'm working, how much are you making? And if you're making too much, then you definitely don't need to file. But if you are not working, then sometimes you need to take the money because you need to pay your bills. And who am I to say you shouldn't start the check? So if you turn 62 and you say, well, gee, Cindy, I'm not working, but I can't really pay the mortgage very well. I didn't save enough. My pension is not enough, or I don't have a pension. If you need your checks, then of course I think you should take them. And if you say, I don't need the money, then the longer you wait, the bigger the check. So I would consider that as well, unless you're in bad health. And then, of course, I would take the money so you could enjoy it while you're still alive. But I think that I think it's a personal question that everybody has to ask themselves. It's just like, when should I retire? And we all go through that. When should I retire? And I always say, you'll know. You'll know when it's time. You'll know when it's time.
Oh yeah, most people that do retire, they wake up and they say,
no more.
That's it. No more. Exactly. And I'm so glad that you said that it depends on your circumstances, because with other aspects of retirement planning, it is very nuanced.
Absolutely.
Like that, and I guess there can't be a blanket statement for the right time.
There is not.
Okay.
There is not.
All right. So if I'm trying to keep up with what I might be getting, or where do I go to check my statement? How often should I be going to Social Security Administration's website or trying to find out?
So Social Security used to send us statements. Do you remember when they said, we would get them in the mail? Every year we'd get them in the mail. We didn't ask for it, and we always think, what in the world is this coming in the mail to me? So Social Security used to send us statements, and excuse me, because of their budget, and we all have budgets. You have budgets. The government has their budget as well. So to save money, they stopped sending the statements because you can go online and get the statement. And if you've gone online to get a statement, I encourage you to do that every year. Every year, because the laws change. If there's any change in your benefit, you need to keep up with it. Because as you said at the very beginning, Winston, every single one of us wants to retire. We all want to retire, and we want to know, can we afford to retire? And that's how you're going to keep up with it. So I encourage people to go online to Social Security's website, which is SSA.gov or SocialSecurity.gov. Either one of them will get you there and get that statement. But if you've never, ever gotten a statement, when you turn 60, Social Security will automatically send you a statement. So there are some individuals that you may have coming into your office, Winston, and say, well, I've got this statement from Social Security, and you're going to immediately know that they're 60 or older because they got it in the mail. But if I went online and I had requested my statement at any time of my life, they're not going to send me one at 60 because they know that I've already set up an account and I can get it myself.
Okay.
So I encourage people at least on an annual basis to get it. And I would wait to get the statement till after your taxes have been filed so that Social Security has time to get their records updated. And it usually takes to the W-2 forms and everything to come in from IRS to Social Security. There's a little bit of a lag time. So I would say at least by March or April, I would get a statement on an annual basis.
Okay, that's good to add to the calendar, to do that once a year during that time. And yes, I am old enough to remember them coming in the mail. And our last guest, he was in his 20s. And said that if you're over 40, you're in the older crowd. So I guess I'm in the older crowd now, and that validated it. So I keep getting these validations that I'm a little
Just in case you forget.
Oh, yeah. All right. So when I go to the Social Security website and I'm looking at my statement, is there a part that I should pay attention to all of it, but are there certain parts of it that are very important to pay attention to?
Yeah, I want you to the whole statement is important. First of all, it gives you an estimate for retirement benefits at various ages. And I want to talk about that in a minute, but I want to tell you all the different important parts. So you have a statement, it gives you an estimate of how much your Social Security is going to be at various ages. But also, and I know that with as many people that are probably watching this, we have a variety of ages of individuals. So the statement also has information about a survivor benefit. So every single one of you, and Winston, you're right in that category as well. You have a child. You want to know that if I died, what would my child receive in a survivor benefit? Because often we think about Social Security only as retirement. But if you have children and you're planning, well, if something happened to me, how would my wife support the family? This is one mechanism to make sure that you understand what that benefit would be. It also has the disability part on it. But I would say the second page of the statement is equally important because it lists your earnings, how much your earnings have been, and the Social Security earnings, the earnings that you paid Social Security taxes on. So I know with Georgia teachers, I have teachers because I think everybody knows, well, you mentioned it, that I do classes with you when out in the field in various places. And some counties in the state of Georgia have opted out of Social Security, so they do not pay into Social Security. So if you get your statement and you look on it and it shows your earnings for the last, they lump them together now in certain years, and then the last about 15 years they show a breakout of what your earnings were. You need to look at that very closely. But if it shows zeros in that column, and you are in a county that does not pay into Social Security, it is correct. So you can look at that and know. But if I did work for XYZ company, or I did work in a county that does pay into Social Security, I want to make sure those earnings are correct. Because remember, I said your highest 35 years of earnings are used. And if I have a zero, I'm going to get less money. So I want to make sure that those earnings are correct. So I think this statement is very, very important. But I have to step back for 1 second, if you don't mind. I just said it gives you a picture of how much your Social Security would be at various ages. And normally that statement is correct. But there are, for some of you that are listening to us right now, that I have to tell you that the statement is incorrect. Because if you are working in a school system that does not pay into Social Security, unfortunately there was legislation passed probably well before you even started working that is called the Windfall Elimination Provision that says the following. If you're working and not contributing into Social Security and you're going to receive a pension from that public entity, then a different formula will be used to calculate your benefit. And consequently, you get your statement and it says your Social Security is going to be $600 a month. And you're working in a county that does not pay into Social Security. What I encourage you to do is to take half of that amount, because that's probably about what you're going to receive instead of that full benefit. So that law applies to, as I said, to anyone that is listening to us that is working in a county that does not pay into Social Security, but it also applies to, like I said, Atlanta firemen do not pay into Social Security. The Atlanta police officers don't pay into Social Security. At one time, when I was working for the federal government, I didn't pay into Social Security because of the federal plan that I was under did not pay in. So it's not just teachers, it's any public entity that does not. So there are times that that statement is not correct. Take half of the amount, and that'll give you a better idea.
That's excellent. I actually have a few more questions about that.
Okay.
Okay. So, all right, if I have, at my age, I'm in my 40s now, and I'm looking through my statement, and I might be confused about that, or I'm not sure if that windfall elimination provision will apply to me. Can I just call Social Security right now and talk to somebody? Is that possible?
Well, you can call Social Security and talk to somebody, but normally, and I have to say that normally the people at the 800 number, they don't. If you say the windfall elimination provision, they may understand it a little bit, but they really can't tell you the calculation. Now, if you go on their website, they do have a calculator, and you can actually calculate it yourself. It takes a little bit to do it. You have to load all of your earnings on it, but you can get it. Or if you go into the Social Security office, if you make an appointment and go into the Social Security office, they can do it for you as well. But I would encourage anyone, try to do it yourself on the software that's on Social Security's website, or make an appointment. Make sure you make an appointment before you go into the Social Security office so you don't have to sit and wait.
Gotcha. Okay. All right. So circling back to the windfall elimination provision.
Yeah.
As you mentioned, there are some counties that don't pay into Social Security here in Georgia, but sometimes these members, even though they're new educators, they may have worked in the private sector maybe for 20 years and then have come in to this position and may leave and do something else.
Right.
So in that case, would the windfall elimination provision apply to them?
It will possibly, not always, but and this is when it doesn't apply to you. If you have 30 years that you paid into Social Security at a substantial level, this does not apply to you. If you have 20 or less, it definitely applies to you. It definitely applies to you. And even if you have between 20 and up to 30, 20 to 29, it'll apply to you, but the severity of the reduction won't be as much. So I'm a good example of that. I worked and paid into Social Security from the time I was in high school until I went to work for the federal government. And then I worked for the federal government for 29 years. I retired and then began paying into Social Security. So I had enough credits when I turned 62 and when I turned 66 in my case to draw Social Security, but the windfall still applied to me. But I worked for 24 years where I paid into Social Security, so my reduction is not as big. But it does apply to, the majority of the people, if they have their 40 credits, they may have just a little check. But when you're retired, and I'm kind of retired as I'm sitting here talking to you, I'm kind of retired, but any check that you get is a good check to receive. So it may not be a huge check, but it'll be something to help pay the bills a little bit.
Gotcha. Okay. All right. Well, there's something that our members will ask us about, something else from Social Security, which is the governmental pension offset.
Okay.
So is that similar to the windfall elimination provision? Is it different?
I want everybody that's listening to us realize that when I talk about the windfall, it's all about you working, and it's all about your Social Security record on your number. It's all about your work history and paying into Social Security. The government pension offset provision applies to anyone that has potential eligibility to receive on a spouse's record while they're alive, while the spouse is alive, or at the spouse's death. And what this law says is if you receive a government pension where you didn't pay into Social Security, 2/3 of that pension will offset any spousal benefit. So if I'm going to, do you mind if I just use you as an example to say you pay into Social Security, Winston? So you turn 62 and you're retired, and your wife is 62 and she's been a stay-at-home mom. She's never ever worked. So in a life case like that, Winston, your wife, if she's never ever worked, she could draw half of your Social Security. So you draw your check, she would get half of that. But let's say your wife did work and she didn't pay into Social Security. She doesn't have any work credits, just like when I used her as an example where she never ever worked because she was a stay-at-home mom. but she didn't pay into Social Security because she was working for her teacher's retirement system in DeKalb County, which is, for those of you that are not around here in metropolitan Atlanta, it's one of our counties here in metropolitan Atlanta that opted out of Social Security. So your wife never paid into Social Security. And she says, you start your Social Security and you say, you know, it's okay. Cindy said that if you didn't pay into Social Security, you can get half of my check. So your wife goes into Social Security and your check's, let's say, $2,000, and she says, well, I want my $1,000. They're going to ask her, do you receive a government pension where you didn't pay into Social Security? And unfortunately, it doesn't word it quite as well as I'm saying it, but that's what it's basically asking you. Are you receiving a public pension? And when she says yes, they will say, well, how much is that pension? And if she said, well, my pension's $3,000, 2/3 of that would offset the spousal benefits. So that $2,000 eliminates her spousal benefit. So the windfall is only about me working. The spousal benefit is only, the government pension offset is only about receiving a spousal benefit. And if your wife went into Social Security and said, okay, unfortunately, my husband Winston died. Sorry, be careful driving home. My husband Winston just died. I'm 60 years old. I understand that I'm eligible for his Social Security check as a widow. 2/3 of that $3,000 just eliminated her $2,000 widow check. So unfortunately, the government pension offset does apply. Now, there's 2 times that it does not apply, and I have to mention them. If your wife, I'm keeping you alive now. You're alive now, Winston, and your wife works at DeKalb County, and you retire and you're drawing your Social Security check, and you tell your wife, or your wife tells you that she loves her job, and even though you're retired, she's not going to retire yet. And she keeps working, and she's still working at 67, and she loves her job because she loves being a teacher. If she's not drawing her pension, and remember I said the earnings test applies until you reach full retirement age. Maybe I didn't say that, but it does not apply when you reach full retirement age. If she's not drawing her TRS check yet because she's still working, then she could receive half of your record. But the moment she stops working, it goes away. So that's one time. But the other time is if your wife was working under the TRS system in DeKalb County and she decided to change schools, and she went to work in a county, and I know that in DeKalb County, the city of Decatur school system pays into Social Security. And she decides that she's going to work for Decatur City school system, and she's going to pay into Social Security. If she, for the last 5 years, the last 60 months that she's under the TRS system and she's paying into Social Security, the government pension offset does not apply to her. So that is an opportunity. Now, I'm asked, should I change school systems? I don't encourage people to do anything like that. I would have to see, if I'm going to go to a different school system, am I going to get less wages and it's going to make my TRS pension go down? I don't know. I mean, I can't say. But I have to say when the government pension offset does not apply. Okay?
Okay, that's really good. That's very good.
It's a game changer for some people.
It is. So you heard it, folks. Cindy said, "Don't retire if you are getting." No, I'm kidding. I'm joking. But no, that's really good because I'd never heard that before, and I do think that people probably are about to make some decisions around that. I just didn't know.
They should look at the whole picture. They have to look at the whole picture. If I'm never going to receive anything from a spouse because I wasn't married or I wasn't married long enough, in order to draw as a divorced spouse, you have to be married for 10 years. I mean, if I'm never going to receive on anybody else's record, then why would you change school systems? You want that. You have Social Security is going to be possibly smaller than what your TRS pension is.
Okay.
So I couldn't do it without having a lot of math.
Gotcha.
And you're the math guy. I'll let you do the math. You do the math.
Okay, all right. Well, I think this question is kind of tacked on to what we're talking about now. So let's say an educator is retired to another educator, and one of the educators. So I will use me since we're using me. All right. So let's say I'm expecting a TRS benefit, and my wife is as well. Let's say I pass before my wife, and she starts collecting my TRS benefit, and she's still working. When it's time for her to retire, will her Social Security benefits be affected because she's collecting my TRS survivor's benefit?
No.
Okay.
So you're worth more dead than alive, Winston. I had to tell you that because they are only looking, is she receiving a government pension that when she starts drawing her government pension, then it would affect her if she didn't pay into Social Security.
Gotcha.
But let's say both of you paid into Social Security and you elected a survivor benefit for her. When she starts drawing her own Social Security, it doesn't affect her. Or if she started drawing your benefit, it does not affect her. Receiving that survivor benefit does not affect her whatsoever.
That is good to know. Okay. Now, what about benefits for a surviving spouse? So here's another example. Let's say I pass first, and my wife is collecting GPO, the government pension.
Okay.
Well, no, she's collecting a survivor's Social Security benefit on my behalf, all right?
Okay.
How do they determine what that amount is?
Okay.
Is it based on my Social Security benefit or my wages?
Absolutely. So if she's drawing a survivor benefit, it's going to be based on how much your Social Security would have been had you retired. Or if you were retired, how much was your check? And if she's full retirement age, she gets what you were going to get. So let's go back to the example where you were drawing $2,000 and she was a stay-at-home wife. And she was drawing $1,000. At your death, her $1,000 would go away and it would bump up to your $2,000 amount. So she would get what you would receive. If she starts her benefits at 60, they are reduced for taking them early. So it's like 71.5%. So it is reduced for taking it early at 60. Okay. That's the earliest a widow or a widower can receive benefits unless they have minor children in their care. The other thing is, though, I need to give a reminder because when I'm at your classes and I go in the hall and people are asking me questions, I'll have a widow come up to me and go, well, my husband died and the Social Security said I couldn't get a check. And my question to them is, are you working? And the answer is yes. So remember the earnings test that I mentioned earlier where you could only make $22,300 this year, $23,400 next year. If they're working, making good money, even though they're a widow at 60, they're still not going to draw because they're making too much money.
Got it. Okay. All right. That's very good. So as you can see, if you haven't already, like and subscribe because you're going to want to watch this again, just in case you didn't catch that the first time. This is so good. Okay, so let's switch to some questions for those that are retired already.
Okay.
Well, maybe some of these are for people that are still working, but a little closer to Medicare eligibility. So what exactly is Medicare?
Medicare became into being in 1965, and it is a federal program, but it's also based on you working and paying into it. So it's not, people confuse Medicare and Medicaid. Medicaid is state and federally run, and it's for individuals that have no money. Basically, they're indigent, and it's, for individuals that have no money. Medicare is a program where you've worked and paid into it. And you're eligible for Medicare when you turn 65, or if you are drawing Social Security disability benefits for 24 consecutive months, or if you have kidney disease and you're on dialysis, or you've had a kidney transplant at any age. And there's a lot of various parts of Medicare, and would you like me to tell them real quickly? Because I know we have time constraints. So Medicare has one part that's called Medicare A, and it's inpatient care in the hospital. So if I have Medicare A, it's free. I don't have to pay a premium for it. I have to be 65. It's premium free. I go into the hospital. After I pay the deductible, then everything is covered. So Medicare A is inpatient care in the hospital. Medicare B is the doctor's part of Medicare, which covers it's called supplemental medical insurances, doctor bills, lab tests, x-rays, outpatient services at the hospital, some durable medical equipment, things like that, everything that's not in the hospital. It does cost a premium, and that premium this year is $174 and I believe 80 cents. I may be off 10 cents, but it's about that. Next year it'll be a little bit higher. They have not announced the rates for them for next year. Medicare B is the second part of Medicare, and it's not free. Now, there are individuals that pay a higher premium, and those are individuals that have adjusted gross income above $3,000, and for couples above $206,000. So there are some people that are paying higher premiums than that. Then there's another part of Medicare that's Medicare D, as in David, and that's the prescription drug coverage of Medicare. So it's not when you're in the hospital, but when I'm home and I have to go get my high blood pressure medication, Medicare D. And that's sold by private insurance companies. And I have to go online to choose it, make sure I have the right plan. Medicare also has, and we're in the open season right now, so all you have to do is turn on the television and you hear announcements about these wonderful Advantage Care plans. And Advantage Care plans are the HMO and PPO plans offered by Medicare. So they're a comprehensive plan that covers Medicare A, B, and D, and usually they'll accept just the Medicare premium of $174.80 or whatever it is, and it's comprehensive. But you have to stay in their network. The traditional Medicare, which is A, B, and D, you have to have a supplemental plan to wrap around it because it does not have catastrophic insurance. So I think that your TRS retirees, I think you have like an Advantage Care plan for your retirees. And I understand it's good and it's comprehensive, and that's what they'll have. So I think that they file for that, and then they enroll in Medicare A and B. But for somebody that's maybe listening to this that's not a TRS employee, I've just described what Medicare is all about.
Yeah, that's really good, because there will be some people who are working for TRS now and may not retire from TRS. And then there are also two different types of healthcare plans based on where they work. So we have the State Health Benefit Plan, and then we have the Board of Regents health insurance plan.
Good.
So
there's two different things going on.
Some differences there.
Yeah.
But yes, thank you for that. Okay. All right. So staying in the vein for retired educators, you already answered this question, but people want to know, can they collect their Social Security benefits while they're working?
And the answer is, it depends. and I hate to always keep using that word, it depends, but it does depend. If you're full retirement age, you can have unlimited earnings. So if I'm 67 years old, I'm still working, and I'm 72, I can make as much money as I want, and it does not matter. I can still draw my Social Security check. So once you reach full retirement age, unlimited earnings. Under full retirement age, as I said, the limit is $22,320. Next year, $23,400. Every $2 you make above that, $1 of your Social Security is held back. So if I have good wages, no. If I'm 63, I'm not going to get a check. But if I'm just working a little part-time job, then it's possible that I could receive some of the checks. It just depends on how much I'm making. Under disability, you really can't work much under disability and continue to draw the check. There's a limit of $1,550 a month, and if you earn above that, they're not going to pay you.
Gotcha. Okay. All right. Now, if my spouse is collecting a Social Security benefit, does me collecting my benefit early, does that affect their benefit or vice versa?
That's a great question. So if you take your checks early and she's going to draw on your record, it doesn't affect her wife's benefit, but if you take yours early, her widow's benefit can't be more than what you're receiving. Does that make sense?
That does.
So if you took yours and your check is reduced, let's say $500 a month because you took it so early, that reduction will affect her because she can't receive more as a survivor more than you're receiving. So sometimes I have individuals that say, you know, Cindy, I don't need the money, but I have bad health. Should I start my Social Security? And normally I would say, sure, go ahead and enjoy it. But then I ask the question, are you married? And would your wife or your husband be eligible for your bigger check at your death? Then they may want to hold off so that that surviving spouse, can get a bigger check. But all of you people that are listening to us, remember that government pension offset. So I want you to keep that in mind.
Absolutely.
Yeah.
Okay. Well, people will ask us questions, and I'm sure you get them as well. Okay, are there any secrets? Are there any tricks to making sure that I'm getting everything that I'm supposed to get? Is there a way to just make sure that you're maximizing your benefit?
You know, it's really hard because Social Security, believe it or not, I know people don't believe this, but they really want to pay you the most they can. But the most important thing to do is to be as educated as you can. That's the most important thing. And to call Social Security, but what I have found, I've had individuals when I'm with you teaching classes, and they'll come up to me afterwards and say, well, when I talked to Social Security, they didn't tell me that. And I think it's more not that they were holding information back, you didn't know the right question to ask. And that's so often the problem that we have is, as you just have seen, all the questions you've just asked me, this is not an easy program. It's not, you know, there's so many nuances to it that I've just described that if you don't ask the right question, you may not get to where you need to be. Their website is really good. I mean, if you do some real research on it and keep going at it, I would encourage you to do that and go in and sitting down with somebody. The people at the 800 number are not as schooled as going in person. I mean, they do know a lot and they can help you with a lot, but they're not as in-depth as when you're sitting across from somebody talking as well. But make sure you get an appointment because otherwise you may be waiting a bit.
I hear that. I hear that. Okay. So going into their website, is that the best place to find out if there's any updates?
I would say that that's the best place to start. To start. And then get yourself educated enough on it. I think this venue is a good venue to at least get your questions together. Does the windfall apply to me? Does the government pension offset apply to me? Mm-hmm. This is my husband's record and this is my record. What am I looking at? I think that this is helpful. So as much as we can educate people and the service that you're giving to the employees to do this and to do the classes that you do, I think I would tell all of you that are watching this, when you have an opportunity to go to a class or you have colleagues that have an opportunity to go to the class, that's the best way to get your information because people are trying to educate you as much as possible.
Yeah.
So,
and you're doing a great job at it, I must add.
I'm trying.
Okay. Now, our retirees and future pensioners want to know, they like security. They want to make sure, like, Winston, is there anything that I need to know? Anything that I need to be prepared for that's on the horizon? So any changes that you can think of that might be coming?
You know, Winston, I keep up to date on pending legislation because I do this for a living and I always want to know what's going on. And I just talked about the GPO and the windfall elimination, the government pension offset and the windfall elimination provision. And there are two bills pending right now that would eliminate them, or one of them would at least reduce the windfall so it wouldn't be quite as painful as it is. And unfortunately, they have not passed. And you all know that we're in November now, and we're at the end of a congressional year, and everything will die on the House floor on December 31st. So I don't anticipate anything happening this year. So there are always bills pending to shore up the trust funds to make sure that Social Security is going to be there for our children and our grandchildren. It's definitely going to be there for us, and it is going to be for our children and grandchildren, but it's not going to be as much. So there's always legislation that they're talking about to make changes. There's nothing that has changed this year, and I am up to speed on everything that has happened this year. There's nothing that has gone into law this year that impacts anything that I just said. Anything that's on your statements, it's all the same. But I would say to go on the website. I'll tell you, one of the easiest ways is to get that Social Security statement. Because if there's legislation change that says, okay, you now have to be not 62 to draw a Social Security retirement check, you have to be 64, it would reflect it on that statement. So I think that getting the statements is just an easy way to keep up on little things of changes that would impact you.
Okay, that's good.
Yeah.
All right. Well, are there any last pieces of advice that you could think of that you want to leave with our audience?
I would say you need to have your statements. You need to take the classes that are offered to keep up on your own benefits, because we need to be responsible for our own retirement. And the only way we can do it is to educate ourselves, I guess, is about the best thing I can say.
That's it. That does
Okay.
it. Thank you so much for joining us today.
Thank
This
you,
was a
Winston.
pleasure.
It was fun.
All right. Yes,
fun.
it was. Yes, it was. And thank you all for joining us today. So that wraps up our session for today. And that actually wraps up our TRS Talk session. So if you haven't already, again, make sure that you have liked and subscribed, and that you are a subscriber to our YouTube channel, because the video will be here and you can check out the TRS Talks that we had with the Stay Health Benefit Plan featuring Louis Amos and also Luke Atwood, who made investing and financial literacy easy. So again, make sure that you like and subscribe, and we hope that you are having a great school year and that you will enjoy the rest of your day. Thank you.